Okay, let's dive right into this explainer and really unpack the evolving and honestly kind of tense relationship between patients who look up their symptoms online and the doctors treating them. Because for years, the absolute golden rule in medicine was just whatever you do, do not Google your symptoms. But the digital landscape is totally transforming right beneath our feet. So we really have to ask, is that advice actually helping us anymore? Or is it maybe protecting a much older, way more complex system of medical authority?
So, why does your doctor actually want you off Google? To get to the bottom of this, we've got to rewind a bit and look at the very valid historical fears of the early internet. Because look, to be completely fair to the medical community here, the early web was an absolutely terrifying place to search for a stomachache.
Back when the internet was young and it was super hard to tell fact from fiction, doctors and GPs were totally right to tell you to stay offline. Googling symptoms back then almost guaranteed a fear-mongering result. The Indian Journal of Medical Ethics even highlighted a phenomenon called cyberchondria. You know the feeling. It's that rapid, anxiety-fueled spiral where a mild symptom instantly turns into a catastrophic worst-case scenario. In the Wild West days of early web forums, one headache search would literally tell you that you had 3 days to live. But things have completely changed. We've shifted miles away from those chaotic message boards. Today, we're looking at highly structured, AI-curated health results. Modern search engine optimization, along with all these new AI overview features, has fundamentally flipped the script. Instead of some random, scary forum post getting top billing, modern search engines are actually designed to pull information directly from much more reputable, structured, and trustworthy sources. And what's super fascinating here is how pharmaceutical companies and healthcare brands are jumping on this. They use a new tactic called Generative Engine Optimization, or GEO. Marketing data from performance.io shows that by structuring their content with clear FAQs and citing authoritative sources, these pharma companies practically guarantee that their specific, compliant data is the very first thing an AI summary spits out to you. Now, whether you believe these highly optimized sources are actually reputable, well, that's up to you. You still hold all the cards here, and you absolutely own your own discernment. And that discernment is key, because AI is definitely not perfect. The Guardian recently reported that Google actually had to rip down certain AI overviews because they dangerously stripped the context out of liver function test results. The AI was just throwing masses of numbers at people without accounting for their age, their sex, or any underlying conditions. It was leaving seriously ill people thinking they were totally fine. So yeah, the technology isn't flawless by any means, but it is undeniably way more advanced than the early internet days. Which brings us to a huge question. As these search engines get smarter and surface way more reliable data, is there another reason doctors prefer we stay offline? Why are we still getting the eye rolls the second we mention we've done a little reading? Well, it might all tie back to this older school of thought called medical paternalism. Basically, this is the idea that the doctor acts like a benevolent parent, making all the decisions for the quote-unquote uninformed patient. Legal and academic reviews from Ghent University note that, historically, medicine was treated like a total mystery to everyday people. The doctor held all the magical knowledge, and the patient's only job was to obey without asking questions. And today, there is a serious, documented tension between that old guard paternalism and your modern right to bodily autonomy. Back in the day, doctors kind of painted everybody with the exact same dumb brush, a habit they definitely picked up when those early fear-mongering forums were everywhere. But nowadays, when you walk into a clinic with credible, structured research, that old system often reflexively views you as a threat to their authority rather than an empowered patient. And brushing off patients like that doesn't just hurt feelings. Ethicists call it a denial of epistemic justice. The Indian Journal of Medical Ethics points out that dismissing a Google-informed patient can literally delay critical care. They highlight heartbreaking cases where patients correctly suspect they have conditions like endometriosis, but they just get brushed off as anxious or hormonal by rush doctors. And that leads to years, literally years, of prolonged suffering. Okay, but what happens when that best interest advice isn't just about ego? What if it's actually influenced by hidden financial factors? We have to step back and objectively ask, could all this pushback against your independent research be tied directly to the medications you're being prescribed, the very medications that help keep these doctors and GPs in business? It actually builds into this massive, complex web of financial influences. The British Journal of General Practice flat out notes that prescribing medication is incredibly complicated. It's influenced by local policies, guidelines, and yes, unfortunately, major conflicts of interest.
Just look at the sheer scale of this for a second. Data pulled from the Disclosure UK database reveals that a staggering £2.7 million was paid by pharmaceutical companies to English general practices in just one single year. We're talking payments for sponsored talks, luxury lunches, and all these low-level incentives that just seamlessly weave their way right into the culture of everyday medical care. And this isn't just happening in the UK. Research published in the International Journal of Health Policy and Management looked at this globally. They investigated something called incentive-linked prescribing in private primary care. This is exactly what it sounds like. Healthcare providers receiving monetary or non-monetary perks from pharma companies specifically for prescribing certain medicines. And the numbers they found are wild. This study revealed that 90% of surveyed private doctors meet with pharmaceutical sales reps on a weekly basis. Let that sink in. 9 out of 10 of these doctors are taking weekly meetings with the exact people whose entire job is to sell them on prescribing specific branded drugs. These weekly meetings completely normalize a culture of deal-making. Doctors might be getting cash, luxury trips, fully paid conference tickets, or even a direct percentage of the medicine sales just for prescribing specific, overly expensive medications. In these super competitive pharmaceutical markets, this kind of kickback culture is just viewed as business as usual. So when you piece this all together, the picture becomes pretty clear. If your own independent research leads you to suddenly question an unnecessary incentive-linked prescription, or if you find out there's a much cheaper, generic alternative out there, well, suddenly Dr. Google is a massive threat to the medical bottom line. You are essentially bypassing their financially motivated structure entirely. So knowing that the internet is no longer just the chaotic, fear-mongering place it used to be, and understanding that these hidden financial conflicts are very real, you have to remember that you hold the ultimate power over your own body. So moving forward, how will you use your own discernment to balance your doctor's advice with your own research? Thank you so much for joining me for this explainer, and definitely keep asking the big questions.